Thanks for joining us, Dr. Locke. Thanks for checking in again this week. The local numbers continue to be around 1 or 2 cases a day. Is this how you expect it to continue in the future? Are we expecting a surge at all in terms of daily cases?
Well, we're not really sure. Uh, if the interventions that we've put in place, all the social distancing and closing all the businesses pay off, then our numbers will keep increasing very slowly or even start to decrease. That would be really great. But if we are, if they haven't helped, then we may see our numbers go up faster. So we're quite happy so far that they've been going up slowly, though, but we're still keeping our fingers crossed as to how things will unfold.
Now, a second case was confirmed in Tilsonburg yesterday. Can you give us some details on this case?
So this was a case who had been in contact with someone else who had COVID. So we know where this person got it from, and the case seems to be doing okay.
And what is the situation at the St. Thomas Hospital after the worker there was tested positive?
Yeah, so that again is a reflection of a system that works. So that worker was a contact of another COVID positive case, so was informed, and then she knew that she was at risk, so she let her work know right away. And at work, she was still actually feeling quite good, but just to be safe, she was tested, and she turned out to be positive. And sort of right about the time, or just after the time we got the test result back, she started to develop more classic COVID symptoms. So she's doing fine right now. And the other good thing about that is that she followed, and the hospital followed all the proper protocols. So she always wore her personal protective equipment and carried out all the actions that she should do when she's with the patient. And that helped to prevent the spread to the patients around her.
What are the protocols if a frontline worker gets tested positive?
Well, then right away, that person is taken out of work, and the hospital and public health step in to determine who that staff worker was in contact with, including other staff workers and patients. And all of those are managed in such a way as to contain the spread quickly. So uh, often those people around that case are not infectious yet. If they were exposed and the virus did get to them somehow, then they would still be what we call incubating. And when you're incubating, you're not yet spreading the infection to others. So if we jump in quickly to make sure that all the contacts know what to do, then we can stop the spread before any of them would ever become infectious.
And are patients notified?
If a patient is a contact, the patient is notified, and the patient is then put into isolation. Now, usually the patient is safe because the hospitals work and have procedures and standard ways of doing things so that we prevent the spread of infection. Hospitals are all about preventing spread of infection from the patient to the staff and from the patient to another patient. So that goes on every single day. So usually the patients are at very low risk in these situations, but despite that, we always treat them just as if they might be incubating, and we keep them apart from everybody else until we're sure they're okay.
Understand. Do you know how many cases there have been in long-term centers in our region?
Well, so far there's been no cases in Woodstock, and we've had one case in Elgin. So so far we're okay. All our long-term care homes are being uh, are giving guidance and directions to be sure that they too adhere strictly to all those actions they need to prevent infections from entering into their home and spreading around their home. So we're working closely with all of them to ensure that we have the highest standards. So far we've been lucky, only one case, and we're on high alert in case there is any other ones coming anywhere.
Is there some testing that's happening with residents and staff, or do they wait until?
So there's no point in testing before there is an infection in the home. It's sort of like trying to do a chest x-ray before you have the pneumonia. It doesn't help at all. But the staff are on high alert for any symptoms that might suggest COVID infection. And if there are any symptoms, and they get tested, everybody who was around that patient, all the staff and all the other residents get tested at that point in time.
Do you know how much PPE is available to the staff at these locations? Are they doing okay?
So PPE is available, and what we've done is instituted policies where all the staff must wear PPE when they're in the home, and that is actually to protect the residents who live in the home from the workers, because the only way that the COVID virus gets into the home is through people coming from the outside who have it in their body, and then they work in the home or they visit in the home, and then they bring the virus into the home. So if the people who work there wear a mask, it's another method of trying to keep the long-term resident home safe. So this means that all the long-term care homes in the province, as well as all our hospitals, need masks. So masks are in short supply. PPE is in short supply, but all the healthcare facilities have gotten instructions on how to be able to best conserve and best use PPE so that we can keep enough of it. So we're okay right now, and we've just heard that the federal government has received a somewhat large shipment, and that will be passed down to us. So we're being very frugal at the moment, and then we hope that we'll have enough until the new supplies reach us.
I understand that some of the staff at these centres move between locations. They have multiple jobs at different centres. Is this still the case?
So yes, it is. There have been advisories to healthcare facilities, long-term care homes, and other healthcare care facilities that in this situation, it's better that a staff person try to work in only one place, and that the managers of those facilities try to arrange schedules so people only work in one place. However, there are shortages of staff people, so sometimes people must work in two places. So we need to be sure that our long-term care homes and our healthcare facilities are properly staffed. So what we're trying to do is minimize the travel between homes, and at the same time make sure that we put procedures in place so that even if somebody works in a different place, that we keep a special eye on that person, where they work and how they use their PPE and all those other things, and whether they have symptoms, so that we can make the risk of them working in more than one place as small as possible. And then hopefully, maybe, I know the provincial government is working hard at recruiting extra staff and extra volunteers. So maybe over the coming period of time, we will have less and less of this needing to happen.
Do you know the resolution of the caseworker who tested positive at Crescent Care in Woodstock?
Yeah, that person was a contact of another person and lives outside of our area. And I understand that she's recovered well and that there have been no other cases at Crescent Care.
Thanks. Now, in these smaller communities and rural areas that aren't seeing the numbers like the bigger cities, do you think there is some confusion surrounding what residents should be doing?
I think there is. I think we would like very, very much to believe that this isn't happening where we are, or some people even would think that this is a big hoax, or that it's not as serious as we're making this out to be. So I think when you look around and everybody around you looks healthy and you don't hear about any cases, then you can sort of think, this doesn't really apply to me. I can go visit my friends and I don't have to keep a physical distance. So that does worry us. This virus is a sneaky little virus. It spreads around really quickly, and some people have it and they don't even know they have it. So I would encourage everybody, even if you don't think it's in your neck of the woods, to just be on the alert that it might be hiding somewhere. And the best thing to do is to follow all the directions that you are being given about, staying to your small family and keeping your hands clean and staying apart from other people.
Now, I see some people in the community were sharing food over the Easter weekend, like cakes and cookies. Is this safe?
It's safe. We always encourage people at all times to make sure that you wash your hands before you eat and before you are with other people. So hopefully, when you come to the dinner table, your hands are clean to start with. The other thing is that when you eat, the food goes into your stomach, which has a very, very high acid level, and that acid level tends to kill anything that was on the food. So at least in terms of viruses. So in general, it's safe.
Now, I know some of the elderly are lonely. Is it okay to visit parents if we keep our distance and clean as we go?
So this is one of those decisions which each family member has to weigh carefully. We need to be sure that our more vulnerable people are able to continue to have a sense of well-being about their lives, and social interaction is very important. So I would suggest that if you feel that a phone call or a video chat it just doesn't do the trick, or that you have some concern and you really do feel that you want to stop by and just sort of see what's going on yourself, then I would suggest that you make sure that you assess the health of your elderly family member. If they have lots of other what we call comorbidities like diabetes or other diseases, maybe you shouldn't. But if they're relatively healthy, you might want to visit them. But then again, be sure that you wash your hands before you enter, that you make sure that your clothes are clean, that you didn't just come from a grocery store or some other place where someone may have inadvertently put a virus on your clothes. That you perhaps consider wearing a mask, because the mask, in case you happen to have the virus in your system, the mask will protect your vulnerable family member from you. And then in the house, do try and stay 2 meters apart or 6 feet apart. So if you weigh all those different issues, you can sort of make a judgment about yes or no, should I or should I not visit my family member.
Are you still experiencing high volume of calls to COVID-19 dedicated lines?
Our calls are still steady. We are still manning them for about 12 hours a day, a little less on the weekend. When this all first started and the orders came out from the ministry to close the schools, And right at the start, we got a large volume of calls. It's quieted down a bit, but the calls are still steady. And we do want to let the community know that we are there for them, that we've got the phones manned all day long, and we're there to try and answer your questions. So if you can't get information you need from our website, we're there to provide you some guidance.
Great. And is there anything else you want to add today?
I get asked a lot lately about what can we do. We often seem to be telling people more what they can't do than what they can do. And particularly as the days get longer and the weather gets nicer and the sun gets brighter, we all want to be outdoors. So I just would remind people that it is safe to be outdoors. We do strongly encourage people to stay in their micro families. We do encourage people to stay the 2 meters apart, but you can go for a run. Just be sure if you're going for a run that if you are coming across another person, that you kind of take a little detour and make sure you stay 2 meters from that other person. If you want to go bicycling, that as well, try and stay apart. So carry on with whatever activities, but do be mindful of people around you much more than you used to be. Be courteous to them. They're worried about you, and be safe for yourself, because you never know if the other person may be having the virus on them. And be sure as well, always when you get home, to wash your hands thoroughly before you walk into the house. As long as we all kind of stick to those things, we should be able to get out and still be safe.
Great. Well, thanks for your time again today, Dr. Luck.
You have a great day. Take care.
Have a great day. Cheers.
Bye-bye.